It is a demonstration of clinical palpation for physiotherapy practice for the knee joint assessment. For the knee joint assessment, we check with according to the clinical patterns practice. So before the palpation, we come with some hypothesis first, and the palpation is to confirm the hypothesis. For here is the proximal, here the distal tibia, here is femur tibia. Okay. So for the checking for the anterior knee assessment, we start with seeing the patellofemoral joint. Of course, we will see some accessor movement, see whether the mobility is good, the tilting as usual. But for PF joint pain, usually we can push up the kneecap patellar a bit and then feel the femoral condyle, because some of the patellofemoral joint pain, then in this position you can always feel the surface of the femoral condyle. Then if somewhere and tear cartilage here, you can feel very sharp pain. Then down to here, this the patellar tendon. Then you can see any tendonitis, tendinopathy. This is a very tough tendon, so that's why you can press a little bit harder to feel it. Sometimes it's more accurate to test in a slightly knee bender position. Beside that, next to it is the two fat pad here for fat pad syndrome. So you can feel, press on here. So see any tenderness and pain, inflammatory sign. Okay. For the ACL injury, usually it's deep inside the swelling. It doesn't come with a lot of pain. It's more for swelling. Of course, you will ask for some instability and confirm with MRI. And some slightly turn, but the medial side of the knee, rather the MCL is more prominent. Then we can feel it on the joint line here, very small area. Even you press on the normal structures, it has some normal tenderness. Okay, so we compare with the good side. But be aware of that, it is complete tear. You may feel some empty feeling, but no pain. No, then this is palpation is for complete tear. You may not feel the pain. Okay, then move a little bit higher, the horizontal joint line of the knee joint. Then you can feel some meniscus structures. If the meniscus tear is more superficial on the wedge zone on this horizontal line, you can feel some tenderness just above the line, then no more. Okay, right? For the lateral side of the knee, same as the lateral collateral ligament, it's around the joint line, very small area here. Then you see any tenderness. Even normal people, you can feel normal tenderness. So if just in front, then you don't feel it. Behind, you don't feel it because it's very localized here. So to feel any tenderness. For the ITB friction syndrome, ITB is the runner's knee. Usually the patient complaint pain is around the lateral inferior part of the patellofemoral joint. Here, of course, you'll feel some tenderness, but mainly the tension and most significant trigger point is about 3 to 4 fingers above the knee joint. Is on the ITB, this is a fat pad here. Because this fat pad is a very sensitive, it contains a high density of the sensory nerve fibers. So it's the irritation, inflammation here goes in and causes the referral pain and causes the ITB friction syndrome. This is the demonstration of the knee anterior, medial, and lateral palpation for physiotherapy practice.